gaurko indari konbidatua Gwerfyl Galeseko Bango Unibertsitateko School of Science, Health Scienceko irakasle titularra izan da, duela gutxi hartu den arte. Bere lana osasunaren ikerketan eta hizkuntzarekiko sentiberetasuna sustatzen oinarritu da, eta bereziki osasunaren arloan hizkuntzarekiko kontzientziaren eraldaketa sostengatzen. Eginkizun nabaria eta nabarmena izan du, testuinguru elebidunetan osasun zerbitzuen erabiltzailentza sarbide eta konpromesua errazten, eta laguntza medikurako eskulan egokia prestatzen, eta garapen hauek Galeseko sektore publikoko hizkuntzaren zerbitzuaren legegintzak estatu du marku berria gorpuztero erabili izan da. Nazioarte mailan ere oihartzuna izan du bere lanak, eta publikazio asko izateaz gain pertsona garrantzitsua da Galesen, bereziki osasun gintzaren inguruan eginiko ekarpenagatik. Eta guretzako ohore handi bat eta plazer handi bat da gure artean izatea. Beraz, eskerrik asko.
Eskerrik asko. Egun on. And now I'm sorry I don't have any more class. I really am sorry, so I must turn to English. I would prefer to speak Welsh. But I don't think anyone speaks Welsh here, no? Okay, well thank you very much indeed for your very warm welcome and for your kind invitation to speak at this, what I believe is a very important conference. I'm absolutely delighted to be here. I'm delighted to be in this beautiful city as well, which I've never visited before. But it's a wonderful showcase, it's a wonderful opportunity for you to showcase the Basque language. In higher education, in health research, in all kinds of research. And demonstrate, I believe, what has been the incredible progress that has been achieved here. As a minority language speaker myself, I have fought endlessly for Welsh language services in healthcare in Wales and in higher education, Welsh medium education for healthcare professionals. So I share your strong passion and commitment. We're on a long journey in Wales, and as for all minority languages, the road is not always easy, fraught with challenges. But we have a clear vision in Wales of what is required. We have a legal and we have a statutory framework to enable us to progress. But there's so much that we can learn from your success in the Basque country. And I know that there is increasing dialogue now between the two countries about how we revitalise the Basque and the Welsh language for future generations. So today I'm going to try and explain to you where we are in terms of Welsh medium provision in higher education. And then, given my background in nursing and my experience as a healthcare researcher and lecturer, I'm going to focus on the clinical importance of meeting people's language needs in healthcare and the implications for establishing a sound evidence base that will inform practice and policy. So regardless of your specific discipline, whether you're a health scientist or an engineer or a linguist or a lawyer, I will suggest that as minority speakers, we can all contribute towards research that enhances language services in healthcare. Working collaboratively, we can make a real difference in improving the safety and quality of our services. And then we can share that best practice across other minority language communities in Europe or beyond. So what about Wales then? What about the context of Wales? Well, I'm retired now, so I'm in a fortunate position, aren't I? But this is where I used to work, this beautiful building in the picture here. Bangor University. Bangor University is in the north of Wales. It's in the heart of the Snowdonia National Park. Beautiful place. You're very welcome to visit. A small town, 18,000 population. And within that town is the university, public university, established in 1844, established by local quarrymen who wanted to put their money into education. They believed that education was the way forward for their children. We have around 11,000 students in the university studying a range of academic disciplines, and most of those disciplines you are able to study through the medium of Welsh. The town itself is set within a location where up to 65% of the local population speak Welsh. So that has a clear implication for the delivery of public services, particularly education and health care. So what about the Welsh language? Well, as I said, we have 2 official languages in Wales. English, of course, but Welsh is our indigenous language, a very old language, a Celtic language. Out of the total population of Wales of around 3 million, there are around about 500,000 of those who actually speak Welsh, representing around 19% of the population. But whilst there are heartlands in the north and the west, if you look at the map here, the darker colour blue, that's where the most dense population of Welsh speakers live. The demography is changing because what we're finding is our young people are being attracted to the more urban areas down in the southeast and the northeast. They're moving away from our rural settings. But the language, the Welsh language, is on the increase, and particularly amongst the younger generation, and that's because of our education policies. And we know your success in the Basque Country in that respect. So about 30% of our Welsh speakers come from that age range of between 3 and 15 years of age. And we now have legislation and strategic commitment by Welsh Government, our own devolved Welsh Government, to strengthen Welsh language services in the public sector, and that includes education and health and social care. But these developments, these recent developments, they are in stark contrast with the troubled history of the Welsh language. Like Basque, it was excluded from public administration for many years. So the status of the language has remained low, and Welsh speakers have inherited a legacy of feeling inferior, ashamed, reluctant to use their language. But in the process of revitalisation, we've seen the establishment of Welsh language radio, Radio Cymru, television, S4C, education, new language legislation and government strategies for public services that are trying to redress this balance. Our most current language legislation was the Welsh language measure, which was passed in 2011 by our devolved government in Cardiff. And this gave Welsh official status in Wales for the very first time. It's hard to believe that it's only 8 years ago that we had official status to the language. The Act itself, it established the role of a Welsh Language Commissioner, and the Act declared 2 important things: that the language should not be treated less favourably than English, and that people have a right to live their lives through the medium of Welsh if they choose to do so. Now, those 2 key principles are the foundation of the new Welsh language standards that have been imposed on public sector services now in light of the Welsh language measure. And they are being introduced systematically now in Wales. And then we turn to the Welsh language strategy of the government. The latest one was published 2 years ago in 2017. It's called Cymraeg 2050, Welsh for 2050. It's about increasing the numbers of Welsh speakers from 500,000 to 1 million by 2050. Great vision. We worry about how it's going to happen, but the investment will be in education and in infrastructure. So we look out for that. As for now, turning to education, well, over the past 50 years, really, there's been a steady increase in the availability of state-funded Welsh medium provision or bilingual provision in schools. And today, there are around 25% of our school children who are taught through the medium of Welsh. Now, in 2011, the Coleg Cymraeg Cenedlaethol was established, funded by the Welsh University, and this organisation supports universities across Wales to develop opportunities for students to access Welsh medium studies at higher education level. So it funds staffing schemes, it funds scholarships, it funds research scholarships, so undergraduate study, master's level, postgraduate level. It funds also student grants and projects from different disciplines. And we can now say that there are around 900 degree programmes now available through the medium of Welsh, partially or fully in Wales, across our universities. And we have work ongoing now in September. There will be all these opportunities available at the college level, that's the post-16 level. Looking back to 2016-17, around 5,000 of our undergraduates were studying either fully or partially through the medium of Welsh, and 1,500 were studying at postgraduate level. Various disciplines there. As the obvious advantages of studying through the medium of Welsh, you will be familiar with these from studying through the language, your language in Bas. Extra funding. We give extra funding to students to study through the medium of Welsh. They possibly have smaller groups, and they tell us that they prefer. They have greater attention. They have a greater rapport with their lecturers and supervisors. Better relationships. They have an opportunity to learn bilingual terminology and help us develop bilingual terminology in their particular specialised field. They have opportunities to develop bilingual skills that are going to be really important for them to gain employment in public sector services in Wales. They can choose to access work placements in Welsh medium areas in Wales, thereby enhancing their experiences. And they get a chance to study for a certificate to demonstrate that they have those abilities to study through the medium of Welsh and to work through the medium of Welsh. And for some people, it's even more important because it actually pays more. Because there is a study to show that people who are able to speak and write in Welsh can earn, on average, around 11% more when they're seeking employment. As for healthcare, which is my particular field, I have a very brief video here of the testimonies of students studying various health professional courses at the University of Wales.
Des I Prifysgol Gaerdydd achos chi'n cael ei dysgu ar campus ysbyty. Chi'n cael teimlad o'r awyrgell, dydyn nhw'n bod fel gweithio yn ysbyty, chi'n cael grifio yn dydd.
Pan mae myfyrwyr ni'n dan dyrweliad yn swydd, mae mwy o ysbytau'n gofyn ydy'r gallu siarad Gymraeg gen ti.
Dwi'n meddwl bod siarad Gymraeg wedi helpu fi i gael lleiad cwrs yn y tro cyntaf. Os mae bod yn dwyieithog, mae'n galluogi fi i darparu gwasanaeth ychwanegol i menywod yn teulu'r cynnwys edrych ar ôl.
yn y brifysgol yn Gymraeg.
Yn ôl i fel tiwtor personol, wedi cynnig unrhyw gefnogaeth mae Mia angen.
Mae fy Gymraeg yn rhywbryd iawn. Mae'n prifysgol yn anodd ni siarad Cymraeg.
Beth ni'n disgrifennu gyda hyder yn fyrwyr yw bod e'n bwysig i ddechrau yn gynnar. So felly ni wedi trial dod i gweithdai sgiliau cyfrif Cymraeg am y flwyddyn gyntaf trwy'r bedwyr flwyddyn. Fi'n credu bod e'n bwysig iawn bod ni'n cynnig gwasanaethau Cymraeg i pobl sy'n defnyddio'r gwasanaeth iechyd o'r cychwyn cyntaf, achos does e ddim fod dyletswydd ar y claf fod yn defnyddio'r gwasanaeth, y dyletswydd ar y gwasanaeth iechyd i ddarparu'r gwasanaethau.
Mae cymdeithas yna, mae mwy o bobl yn siarad Cymraeg, felly mae'n bwysig bod gweithwyr iechyd yn gallu mynd o'r ysbyty mewn i'r cymuned yn y tŷ a siarad iaith gyntaf o bobl.
Nes i'n siarad Cymraeg, plant nhw yn cael epilepsi. A jyst yn gwaith yn siarad Cymraeg ni, ysyn gyd yn gwybod yn gyd yn gallu siarad. Fel, hwnna'n reward dda, yn gwybod fi'n gwneud hwnna, ni'n gallu helpu.
Mae cleifion sy'n gallu siarad Cymraeg a moyn siarad Cymraeg. Mor fath i fel bod ni'n gallu, yn ymwedig pan nhw'n sâl yn teimlo nôl.
Ar y bod yn ansio, ydyn ni'n claf, a ni'n gwybod siarad Cymraeg. A yn ysgrifennu bod ni'n siarad Cymraeg, yn gwmni trwy'r amser gyda hi, a siarad Cymraeg. Ar y diwedd yr wythnos, ni'n dechrau siarad i un o ddau gair yn siarad Cymraeg. A wedyn, yn neis gallu roi'r ddyn a cael wythnos.
Okay, so why should language be a priority in healthcare? Well, you probably don't know the answers to that. But firstly, most importantly, on the basis of clinical needs. There's no doubt that effective communication is the foundation of healthcare. And if we think about the role of language, it's not just about exchanging information, it's more than that. It's a means of expressing our innermost thoughts and emotions and expressing our identity and our culture. So providing language appropriate services is surely a matter of quality, as well as ensuring the safety and the dignity of patients, particularly when people are at their most vulnerable as they are when they access healthcare. And we know from the international evidence about the detrimental impact of language barriers in healthcare and their effect on health and well-being. So, as is the case for the Basque Country, in the bilingual context of Wales, we need quality services in Welsh as well as English. And secondly, we're bound by the legal and statutory requirements I showed you earlier. And thirdly, we must remember that the professional standards that are set by our regulatory authorities require that practitioners address individual language and cultural needs in the delivery of care. Now, in Wales, people choose to receive health and social care services in Welsh because that's their preference and that is their right. But for other people, it's more than just a matter of choice. It's actually a matter of need. For example, we know that some specific groups of Welsh speakers are particularly vulnerable if their language needs are not met. For example, older people, younger children who may not be speaking English until they access education at school around the age of 7. People with mental health problems who find it difficult to explain their innermost thoughts and feelings through a second language, and so on. So that's why in Wales, as I know in the Basque Country, we're adopting the principles of the active offer in healthcare. So this is about providing a service in Welsh without someone having to ask for it. Creating a change of culture within organisations that takes the responsibility away from the patients and puts that responsibility on the organisation that's delivering the care. not making the assumption that all Welsh speakers speak English anyway, because they don't, and they particularly don't when they're feeling vulnerable. So we can demonstrate this by wearing a badge, a lanyard, using the signs. And I've seen the signage for myself in the hospitals in IkerGazte. But this is only a small part of the picture. The truth is, in order to provide an active offer of services in Welsh, a whole system approach is required to guide service planning and service delivery. So workforce planning and development is key, as is the establishment of the organisational environment that is conducive to foster this bilingual, institutional bilingualism. As we can see here, this is our strategic framework for Welsh language services in healthcare. We have the 7 key objectives around the outer core here. Inside we have people receiving high quality language appropriate care, and that's achieved through this active offer where we need leadership, we need mapping and auditing of who our Welsh speakers are, we need service planning and commissioning, professional education through the medium of Welsh, Welsh in the workplace, and so on. So investing in the healthcare workforce of the future is a priority for us. In order to deliver the active offer, it's imperative that the workforce reflects adequate levels of Welsh language skills and sensitivity. But let's pause here for a moment to think about what we consider to be the makeup of the healthcare workforce in a bilingual context, and who contributes to this workforce and these key disciplines. Well, it's very clear, isn't it, that we need clinicians, we need practitioners who are able who have those bilingual skills to engage with service users and provide that active offer. But what about the role of linguists and terminologists in revitalising minority languages in a domain where that language may have been excluded for decades or even centuries in our context? And given the increasing use of IT systems and software in healthcare, we also need those who are apt at working in 2 languages and have the commitment to develop bilingual systems in collaboration with language specialists. And then we need language planners, we need sociologists, we need psychologists. They have huge potential in working together to guide policy and practice at a broader organisational level that supports the provision of quality bilingual services for all. So, if we are to truly embed Welsh language services in Wales using a whole system approach, then we need a much stronger alignment of our organisational systems and processes, together with closer collaboration between the disciplines that inform these systems, and an understanding of the bilingual context in which they work. Arguably, studying through the medium of Welsh offers this added insight, and collaborative research and development enables us to establish a body of evidence in Wales that can inform future policy and practice. So whether you're a healthcare professional, whether you're a health scientist, an engineer, a linguist, I envisage that in the Basque Country, having studied in Basque and having the ability to engage in your discipline at a professional level through the Basque language, there must be a role for you in enhancing Basque language services in healthcare, where collaborative research and development is key. Now, in order to demonstrate just some of the success stories from Wales and to make it more interesting for you about the collaborative research and the scope for enhancing health services in Welsh, I'm going to draw on some of the experiences that we've had in dementia care. There are currently around 42,000 people in Wales living with dementia. With an ageing population, we anticipate this figure will increase significantly over the next decade. Dementia, as we know, affects memory, mood, cognition, and language and linguistic ability. And bilingual speakers are at risk of often losing a grasp of their second language. So failure to provide care in Welsh for some patients can lead to frustration, loss of dignity, misdiagnosis, and mistreatment, mismanagement. Indeed, there has been some recent studies in Wales that reveal that the needs of Welsh speakers living with dementia are not being met. So even though there are national policies and strategies about care through the medium of Welsh, not really being reflected in the grassroots services. So there's lots that we need to be doing in Wales in terms of quality improvements in dementia care. So the examples I want to show you today include the following research and development projects that bring together Welsh-speaking members of various disciplines, from terminologists, clinical psychologists, to musicians and software engineers. Whilst all these people have their own expertise in a particular field, given that they're bilingual and they engage in their studies and their research in Welsh as well as English, they have a broader insight of ways of working in a bilingual context. I believe that it's this unique combination of skills that sets them apart and enables the success of these projects in establishing the evidence to enhance our Welsh language services for dementia care. Now, Bangor University has a particular expertise in this field, with collaboration across various research centres in the university. So I'm going to just briefly discuss the following projects for you. The standardised Welsh language screening tools to assess diagnosis in dementia, music therapy to aid communication and well-being, intergenerational care to enhance well-being and social cohesion, and language technology to assist independent living. Now, patient-reported outcome measurement and assessment tools are used increasingly in health research and in clinical care. But there are significant challenges in establishing equivalence between the original and the translated version of instruments. And this poses a huge threat to their reliability and their vulnerability and their validity in research and practice. And this is really particularly evident in dementia screening, where language skills and memory and mental functioning are really central to these tools. But the key differences between the structures of the language, particularly between Welsh and English, suggest that direct translation of these tools would be entirely inappropriate. This makes the adaptation process, we call it, an arduous task, requiring a specialist input from a range of professionals who adopt a standardised protocol to assure technical, linguistic and conceptual equivalence. Now, the Welsh Government currently funds the programme of work at Bangor University called Llais, which then hosts these different measures, different assessment tools on an easy access, interactive website. The multi-disciplinary team works entirely through the medium of Welsh. It involves researchers from the Clinical Trials Unit, clinical psychologists from the local health board, translators, terminologists, and software engineers from the Language Technologies Unit. and most importantly, service user representatives from our local Welsh language community. Here's a brief overview of the work. Project ydi hwn yn reswm sydd wedi mynd i'r afel ar gyfieithu cyfieithu Cymraeg o felly offer asesu dibyddol. Dwi'n gyhoeddi hwn gan gyfieithu Salsen yn ôl yn 2013. Fel ydych chi'n mae'n boblogaeth yn gynulleiddio ac mae'n niferoedd cynyddol o bobl bellach sy'n dioddau o dementia. Mae hynny'n rhoi problem sialens os ydych chi arbennig i ni'n Cymru yn un o'n gwlad dwyieithog, lle mae rhan bobl hefo dementia wedi gafel yn Saesneg wrth i'r cyflwr ddilwio. Nawr te, mae bobl dementia, mae asesu yn gynnar yn hynod yn bwysig. Wrth asesu, mae arbennig i defnyddio dulliau asesu arbennig iawn, dulliau safonol, mesurau. A mae'n bwysig iawn cael rhai ar gael yn y Gymraeg yn ystafell Saesneg. I wneud yn siŵr bod yr asesiad yn un dilys ac yn un dibynadwy. Mae pecyn i hynna yn rhoi cyflwyniadau i ymarferwyr yn y maes am unrhyw pares sydd yn ddefnyddio, sut i ddefnyddio fo. A mae'n cynnwys 7 mesur i ddefnyddio. Nawr te, dyn ni wedi cyfieithu a difysu yn ieithyddol 3 ohonyn nhw. Mae hynna'n golygu yn rhoi gael i ymarferwyr ar draws Cymru gyfan i ddefnyddio yn rhan ar hyn.
Y broses yn ddiddorol iawn. Mae pan yn ddefnyddio yn ddyn nhw'n ffantas yn ôl gyfeilltu pecyn i'r Saesneg ydy yn lot mwy na hynny. Gyntaf, dych chi'n dechrau gyda cyfeithiad, sydd yn gael gwrs, ond wedyn dych chi'n ôl gyfeithiad i'r Saesneg. Ond mae'n golygu bod chi'n cael cyfle i edrych ar unrhyw broblemau gyda'r gwylio unrhyw gamddeithwyddiaeth, unrhyw beth sydd yn peri anhaster. Ar ôl hynny, mi ydych chi wedyn yn ei adolygu fe. Mi ydych chi'n edrych yn fanwl ar y leidfa, bydd yn tafodieithol, bydd yn effaith yn peri problem, hyn sy'n mynd ymlaen yn pedwerydd cam sydd yn mater o dreialu. Mae hyn yn hynod o bwysig. Chi'n defnyddio yn achos ni'n gwirfoddolwyr i ateb y cwestiynau fel petai wedi mynd y prawf o ddifri a bod nhw yn gallu gweld wedyn unwaith eto o yna bethau anodd i deall neu pethau'n cael eu camddeall yn y ffeifio. A gyda pob cam, ydych chi'n newid cyfieithiad nes bod chi'n dod at fersiwn, ydych chi'n hapus gyda'r fersiwn derfynol.
Wel, dwi'n meddwl bod y ffaith bod gennym ni lyfryn a pecyn ar gyfer bobl sy'n siarad Cymraeg a sy'n o bosib efo dementia yn holl bwysig. O brofiad, dwi'n cofio aelod o'r teulu yn cael trwy bosib efo diagnos. A dim un yn cael ei holi drwy gyfer y Gymraeg ac yn diwedd y diagnos yn hwyrwyd cael ei dweud. Mae'r pecyn yma yn dangos cyniad, mae iehebio mewn beth eraill yn nhw ac mae o'n ddefnyddiol dros ben ar gyfer y pobl sy'n mynd trwy'r broses.
Okay, let's move on to evaluating the impact of music therapy then. This again is a focus of a growing area of research at Bangor University School of Music. Current research projects focus on the impact of music therapy on the health and well-being of people with dementia in the local Welsh-speaking community. And the School of Music uses artistic residencies in local care homes and assessment units as case studies for their research. And the results of these projects show that music has the unique ability to communicate and connect with people with dementia, even when their symptoms are moderately severe. The familiarity and recognition of the Welsh songs bring comfort to individuals, enabling them to make some connection with the past and communicate with the present. And this has the potential to improve the quality of life of residents and reduce problematic behaviours associated with dementia. The multi-disciplinary team in this context works entirely through the medium of Welsh. It involves musicologists, clinical psychologists, care staff, and video and sound engineers. I'm going to show you a very brief video now of a musician, Mam Llwyd, who looks back for the first time at the effect of her musical residency at a care home in North Wales. As she performs in a one-to-one session for a 93-year-old gentleman called Emrys, she plays a childhood favourite of his on the traditional Welsh harp, which, as a result, floods his consciousness with a range of different memories from his past.
Emrys yn 1990 efo Parkinson's, mae gynnu fe gymryd o iechyd. Ond mae'r ffordd mae wedi mateb I gerddoriaeth wedi bod yn anhygoel. Dwi'n pawb o'r staff yn teimlo bod hon yn stori ar ben I ôl. Mae'n rhywbeth I rioed wedi sylwi ar hyn am fel hyn, achos yn yr achos yma dwi'n gweithio yn chwarae'r delyn. Ac o'n i'n siŵr os oedd Emrys yn mwynhau y delyn, a dweud gwir yn achos. Beth dwi'n weld arno, mae'n gwrando mor astudd. Mae'n cymryd pob peth I fewn. O, mae'n asyl. Os mae'n gallu chwarae hynna? Nes I ddim sylwi hynna o gwbl o'r onest. Mae'n dallt beth dwi'n gwneud. Waw, nes I ddim sylwi hynna ar y pryd, mae ddim berffaith onest. Ydy mae'n sach chi digwydd, ond mae o'n meddwl, mae o'n ystyried, mae o'n matab o jyst yr dwi'n cytuno. Mae o'n deall, da ni'n siarad yr un iaith, mae hwnna I mi yn waith fawr i'r gwaith. Mae'r prosiect, os yw'r cerddoriaeth, bod ni'n gallu bod yn llwybr i'r llans o hwn, bod yn y cartre. Yna, dwi'n meddwl bod ni'n gwneud waith.
Moving on then to another project about the impact of intergenerational care. Well, with an ageing population and the pressure on public finances, the rising cost of childcare, and the need for more Welsh language services, new ways of providing care are on the increase. And as part of their studies, evaluating the impact of Welsh medium intergenerational care, researchers from the University's Dementia Services Development Centre and the School of Education and Psychology bringing together two very unlikely generations of Welsh-speaking preschool children and older adults with varying degrees of dementia. In a unique opportunity, a temporary setting was created so that children from a nursery spent time at a day centre to socialise, dine and take part in activities with older people. Under the watchful eye of psychologists, the study revealed what happened when this age gap is bridged and the transformative effects that emerge. From the children's perspective, we see that they developed positive relationships with the elderly and grew in confidence as they worked together on various tasks. And the older people were seen to have an opportunity to share lifelong skills and enjoy the company of children in a supportive environment. Once again, the team works entirely through the medium of Welsh. It involves clinical psychologists, educationalists, care staff, and video and sound engineers. Although this is just a preliminary study, there's wider research internationally confirming that bringing generations together can and should be the way forward for care systems. And the benefits of this particular study are significant in demonstrating, enhancing language transmission within the community and across generations, which again is in line with our government's strategic drive. Here's a very brief clip of the work.
Mewn carafanydd gofal ar draws Cymru, mae arbrawf arwysol ar fin digwydd. Am y tro cyntaf, bydd y pensiynwyr yma'n rhannu gofal dydd gyda plant bach.
Pwy sy'n am hyn, wen?
Ac mae seicolegwyr yn credu gallu gofalu mae hen ar ifanc cael gilydd bod yn dda i bawb.
Cyfled yn ofynhau cwmni plant.
3 diwrnod. 2 genedlaeth.
Ti'n byw, mi'n ei ti'n byw.
Hen blant bach, nos Sul ar Ysbrydreg.
It's a nice clip, isn't it? So I'm coming to our last example for you now. And it's about Welsh language technologies. Now, assistive technologies can help people with dementia to improve and prolong their quality of life and make the care provided by the family easier when people are unable to carry out their daily tasks as the illness progresses. And these devices include, for example, automatic reminders to take tablets, movement and location sensors, temperature control appliances, and so on. And these can help facilitate memory and recall. They can help manage potential risks around the home, promote independence and autonomy. And they can actually delay or even postpone early entry into care homes and hospitals. But the ability to receive, understand and act on verbal messages and the ability to give human voice to automatic messages all mean that human language or languages must be used. And if Welsh cannot be used in these contexts, we will have no choice but to interact in English with these devices, and Welsh will be excluded from the digital world. Now, the Language Technologies unit at the university has a special interest in language revitalisation through language technologies and enabling less resourced languages to thrive in the digital age. With its primary focus on Welsh and other Celtic languages, it pioneers research and development in text, speech technologies, terminology standardisation, and other aspects of natural language processing and computational linguistics. Working in partnership, for example, service users and families, healthcare staff, software engineers, linguists, psychologists, and educationals. And these projects offer a vital lifeline for health and social care, providing additional support from a distance. The sort of examples include Maxen. This is an open source Welsh language digital assistant that uses speech recognition, syntax analysis, and text-to-speech technology to speak the appropriate response. And then we have a Welsh version of Siri, which offers an additional facility, and that makes it possible for you to speak with your device, such as your phone or computer, with Welsh in order to command and control appliances. It's early days, But this work should stimulate the development of new Welsh language software and services to maintain the Welsh language in human-computer interaction and enhance the quality of lives of those people living with dementia. Now, one of the projects that's received much attention recently is actually beyond the realms of dementia, but it demonstrates the latest language technology achievements of the unit in enhancing quality of life for patients with speech difficulties. The name of the project, it's called Lleisiwr, and it's sponsored by Welsh Government, and its aim is to create personal synthetic voices for patients who are about to lose their ability to speak because of diseases such as motor neuron disease or throat cancer. Patients are referred by their speech therapist to the centre, where the project stores their voice and creates a synthetic voice for them to use in the future. By using a computer or a phone or a tablet, Lleisiwr enables patients to type a message in their language, their preferred language, and that plays an audio clip in their own unique synthetic voice. Now, pioneering work at the unit meant that a man who lost his voice recently following cancer treatment 2 years ago is now able to use his own synthetic voice. Having earned a living as a spokesperson actually for the university and being an active member of a local choir, he was a keen amateur singer, John, his voice played an important role in his professional role and his personal life. And when he and his wife Nan understood that specialisms relating to synthetic voices were being developed by the unit and in Welsh, she decided to contact the unit. In John's case, unfortunately, the ability to record text had already been lost. He'd already lost his voice. But using audio clips from the family archive and supplementing those with recent contributions from John's brother, David, the unit's software engineers and linguistic experts set about recreating his voice. This time, the service user and the family were heavily involved in the project, along with a speech and language therapist, linguist, speech transcriber, and software engineer. This is the very first time that a unique synthetic voice has been developed in Welsh and created from combining two separate voices, that of John and that of his brother. The hope is that the project will flourish to enable others, like John, to regain their voice and quality control. Two very brief videos, 2 minutes long, just to show you the glimpse of the project at the start and the end result. Okay, so that was the very last example for you there. So what are the key messages then for me? Well, as in the case of the Basque Country, Wales is a bilingual nation where the Welsh language is an important part of its national identity and its legislative framework. And this has important implications, doesn't it, for delivering public services, particularly in the context of health and social care. But if we are to embed minority languages in the heart of healthcare delivery, we need a much stronger alignment of organisational systems and processes and closer collaboration between disciplines that inform these systems. Equally, we need strong insight and understanding of the linguistic context in which these systems function. So I believe that conducting multi-disciplinary research and development, where the minority language is both the focus and the medium of study, is crucial in establishing the evidence to enhance services. Working in partnership, I believe there's scope for us all to make a real difference in improving the safety and quality of those services and sharing our experiences and our best practice across minority languages within Europe and beyond. IkerGazte.
Thank you. Good presentation. I was delighted. So, seeing both of you are working with Welsh, just to motivate people here, I have to say that there are similar efforts here in the Basque Country. I am working on language technology, and I know very well David Priest. Yes, I have been collaborating with her sometimes. In the Basque Country, there are interesting experiences on this also. For example, in the way to make conversational agents, dialogue agents to speak to the computer, in the ISA group in the University of the Basque Country, we are making our first steps on this, and we need people to record dialogues. This is why you found this paper yesterday on the mark. We need many dialogues to make it possible. In the same way, we have other works to develop a language in health field, in the field of health. And we don't know this. Yeah, yes. Yes, I think Olats has something to do.
We've been emailing months ago, yes.
Yeah. And about these experiments about creating new voices, or to recover the voice of somebody who lost it. It's very interesting, the work made here in the engineering school in Bilbao, our lab. And they are making similar experiments, and they are making good work on this. Yeah. Again, Welsh and Basque work together because your last lines there, we need collaboration between minority languages. Thank you.
Thank you very much.
IkerGazte galderak badago. Thank you for this inspiring talk. My question is, how do you convince the rest? Because here you came to preach to be converted, but there is, let's say, there a lot of people, a majority in this society, who doesn't believe in what we are doing. Not only that, who think they are obsessed with our identity, because speaking Spanish is so easy, or French. So why are you doing that? They are asking us this, and I guess that you have the same problem. How can you solve this problem? How do you convince the rest of the society?
Wow. It's a very difficult question, isn't it? I guess...
No, the question is easy, the answer is difficult.
Yeah, the answer is impossible. But we share, the question, we hear that question all the time in Wales too. It's an easier question to answer if I put my nursing hat on, because there's no question in healthcare, is there? If you understand the essence of communication in healthcare and the way that language is a means of communicating with somebody and enabling them to open up and have that relationship. So the question in healthcare is easier. So outside healthcare is more difficult. I guess we're looking at, in a sense, the difficulties maybe that sometimes occur when people are monolingual and we try to ask them to look at the world through a bilingual frame, and they find it difficult. So we have to take time to explain to them the actual nature of bilingualism and the way that it works, if you like, that we use language in some context, we use one language, and in another, if we look at another context, it doesn't feel the same for us to use the language in that context at all. how else? Outside healthcare. I mean, in Wales we are fortunate that we have the evidence now that shows us that public services have no choice but to provide bilingual services. So if you are studying, why would you not choose to study through the medium of Welsh? Because do you want a job at the end of the day? Do you want to do well? You are going to miss out if you don't study through the medium of Welsh, if you don't have those two languages. And people who learn Welsh, we have many people who learn Welsh as an adult, and they say to us, oh, I wish my parents had sent me to a Welsh school, or I wish my parents had encouraged me to use Welsh, because now I have to spend some time catching up and learning Welsh. So I think it's about being positive, not being reaching out to people rather than saying no. It's something that is just for us, for Welsh people. It's something private. We have to make sure that we embrace everyone. In terms of the Welsh language, particularly, and say it's not just something for Welsh speakers. It's for everybody. So when we teach in the university, for example, we don't tend to, in healthcare anyway, we don't divide the classes. We try and reach out to people who speak Welsh, who are learning Welsh, who maybe only have a few words of Welsh, and we bring them together and try to get them all to say, this is for all of you, not just for those minorities, it's for everybody. I don't think that answers your question very well, but perhaps it gives you a little bit of a flavour.
Hello, nice talk, thank you. What about the dialects when creating these talks? Because I don't know Welsh, but in Basque we have many different dialects, so I think this will make much harder the task. Thank you.
Good question, and it's a question that people often ask, isn't it? Many years ago it would have been a problem because people from South Wales may not have really understood people from North Wales very well. But it's all changing because we have Radio Cymru, we have the television, so we now have more of a standard language at the formal level, and because there's more movement between North and South Wales, for example, everybody understands the dialects now. There's not so many differences. But when we come to do the assessment tools, very, very important, and we need to ensure that we adopt the standardized terminology, the standard. So that is the purpose of standardizing terminology, really. And in our dictionaries, what we do is, for example, in healthcare, we may have the standard clinical term, which would be the standard Welsh. And then if we are aware of a dialect term in North Wales and South Wales, we will include the dialect, but we will tag the dialect. So it will have F for familiar term. So that's how is that the same for you? Yeah.
Besterik ez da, eskerrik asko.